A third technique for the spinal erectors will be demonstrated in this video, one that perfectly complements the first two spinal erector techniques. However, this technique will not only treat the spinal erectors, but all of the surrounding musculature, including the quadratus lumborum. 4 sites will be treated, corresponding approximately to lumbar vertebrae 1 through 4. As indicated by this image, only one of the AcuLever blades will be used for this technique, with the blade perpendicular to the spinal column. The angle of the tool will be at 45 degrees to achieve this, and you will use only the top plate of the AcuLever. There will be 3 different maneuvers done for each of the 4 sites. The first using the tip of the blade to treat the spinal erector adjacent to the spinous process. The spinous process is the bony tip of the vertebrae that extends backwards from the body and is relatively easy to locate with the tip of your thumb. Set the AcuLever at the 45-degree angle to your spinal column and reach behind you with your thumb to locate the spinous process of the first lumbar vertebrae. Roll onto the AcuLever while keeping the same side leg bent in this position. With this leg bent, the tip will push into the muscle correctly. Note that the body is angled off the floor or table in this position. The second maneuver on the first site will emphasize half of the blade and extend the therapeutic pressure further across the spinal erectors. To execute the second maneuver, simply straighten out the same side leg. Note that the body has shifted position where the treated side is angling less off the table or the floor. The third maneuver on the first site will emphasize the full blade and extend the therapeutic pressure fully across the spinal erectors. To execute the third maneuver, bend both legs and elevate your body onto the tool. Note that the plane of the body has shifted position where the body now is parallel to the table or the floor. To move to the second side of this technique, use your legs to elevate your body, shifting forward approximately an inch, and lower yourself back down into the position for the first maneuver. You will repeat all 3 maneuvers for this second side of the technique, starting with the point emphasis adjacent to the spinous process. Then straightening the leg for the second maneuver with the half blade emphasis, and then finally lifting your body onto the tool for the full blade emphasis. Move to the third and then the fourth sites of the technique, repeating all 3 of the maneuvers like you did at the first 2 sites. After completing the 4th site of this technique on one side of your spine, simply repeat the entire sequence on the opposite side of your spine. It is recommended, while your muscles are this open from this technique, to do a quick routine of the spinal erector's first technique. This will help to create a real symmetry between the 2 sides of the spine. Just do 3 sites, either catching yourself on your forearms, as shown in the video, or going back all the way where you touch your shoulder blades to the table or floor. Do move back and forth between at least 3 sites for this technique so that your low back muscles can open up completely. The extra effort here is worth the time invested, as the best therapeutic work is done when the muscles are wide open. This emphasis on symmetry will go a long way into freeing up your low back.